The two children seen in the video were real students that have been referred to the doctors for failing or for being Linus Tegar. They have not been seen or assessed by any doctors before, prior to this filming. After viewing the children performing the tasks in this video, now discuss the probable diagnosis of Child 1 and Child 2. Give your reasons for your diagnosis.
This is a learning disability assessment tools that should be filled up by the assessor. First part should be filled up by the nurses or by the doctors. The second part should be assessed by the doctors, while good history taking from the parents and also teachers. Physical examination should be done by the doctor. Developmental and cognitive assessment also should be done by the doctor. Assessment of gross motor according to the age, 5 years, 6 years, 7 years, 8 years and 9 years. Activity of daily living, shapes, then we assess fine motor, pencil grip. We assess cognitive, good enough, draw a MEN test to assess patient mental age. Cognitive reasoning, assess speech and language in 2-step command and 3-step command. We also can refer the Linus screening tools done by the teacher by identify problems from the Linus instrument. Our main concern in terms of assessing identification of problems from the Linus instrument, we use items number. For example, intellectual disability or mental retardation, item number 7, 8, 9, 11, 12, 13 and so on until 31, most probably the student have intellectual disability if the answer is yes to these items. And same goes to autism, ADHD, specific learning disorder, and last but not least, coordination problem. Then we proceed another tools, instrument Senarai Semak Dyslexia, whereby the student will bring along this assessment tool that been done by the teacher at school, and it should be signed by the teachers that assess the student, and from there they will put the score. If the assessment done by school showed the score 1, 1 at this level, code 1, 1 and 1, showed that most probably this student have a problem of dyslexia. The next part, we also assess the student in terms of social and behavior aspect, whereby we look into the student strength and also weakness. We also assess the comorbidities, other problem that the student have. The last part is our impression and differential diagnosis, whereby we find out what is the type of disability that may occur in the student. After the assessor have examined and assessed the student, the assessor should sign and chalk their names.